Stroke diagnosis: what blood tests are needed? Imagine you're suddenly unable to speak clearly or feel weakness on one side of your body. These could be signs of a stroke, and quick diagnosis is vital. Blood tests are an important part of figuring out what's happening in the brain. They help doctors understand the type of stroke, the underlying causes, and what treatments might be safest and most effective. One of the first tests often ordered is the complete blood count. This test measures the number of red blood cells, white blood cells, and platelets. Platelets are tiny cells that help blood clot. If platelet levels are too high or too low, it can increase the risk of clotting problems or bleeding, which are both relevant in stroke cases. Doctors also check how well the blood clots by doing coagulation tests like prothrombin time and partial thromboplastin time. These tests show how quickly blood clots form. If clotting takes too long, it might suggest bleeding issues. If it's too quick, it could mean a higher risk of clot formation. Knowing this helps determine if blood-thinning medications are safe to use. Blood sugar levels are another key factor. Both very high and very low blood sugar can mimic stroke symptoms or make brain injury worse. Checking glucose helps doctors decide if the symptoms are related to a metabolic problem or a stroke. Electrolytes and kidney function tests are also important. They give a picture of your overall metabolic health and help ensure that certain medications can be safely used. Imbalances in electrolytes like sodium or potassium can affect brain function and recovery. Recent advances have introduced measuring specific proteins called biomarkers. One such protein is glial fibrillary acidic protein, or GFAP. Elevated GFAP levels are often seen in bleeding strokes or hemorrhagic strokes. This marker can help quickly distinguish between bleeding and clot-related strokes even before imaging results are available, speeding up diagnosis and treatment decisions. Doctors may also order tests to check cholesterol levels and markers of inflammation. These help identify long-term risk factors for stroke and guide prevention strategies. In some cases, additional tests for clotting disorders, heart-related markers, or infections might be ordered based on the individual's symptoms and medical history. It's important to remember that blood tests are used alongside imaging studies like CT scans or MRIs. These imaging tools confirm whether a stroke is caused by a clot or bleeding. Blood tests alone cannot definitively diagnose a stroke but are essential pieces of the puzzle. They provide information about clotting ability, metabolic health, and stroke type, helping doctors make accurate, timely decisions. If you or someone you know shows signs of a stroke, seeking immediate medical attention is crucial. Healthcare professionals will perform these blood tests along with imaging to ensure the right diagnosis and treatment plan. Always remember, every person's situation is unique, and medical advice should come from qualified professionals who can interpret these tests in the context of individual health.